Most medics usually know that clinical practice is the only career option, and that is why nowadays, especially in African countries, the hospitals are so saturated because everyone is trying to fit into the clinical practice, and most of us don't know that there are other alternative options when it comes to careers for medics. Hello beautiful people, welcome back to another video. If you're new here, my name is Lesodur, and so in today's video I'd like to answer some of the questions that I got from my Instagram Q&A. I asked you guys to tell me which videos you'd like me to create, and so I got various questions, and I'll be able to answer them each. I'll be creating a video for each question. And so for today's question, alternative careers for medics, it had two questions: alternative careers for medics and navigating the Kenyan job market. So I'll be tackling this in two. So today I'll first start with the alternative careers for medics. And before I get into the different career options, you should first ask yourself, why do you want to leave? Maybe because your current job is so stressful, or the pay is so little. Like you find most of nurses and medics in African countries, let me talk specifically about Kenya, nowadays are moving to other countries because they want better pay and they want less stress. Because you find that here in Kenya, the pay is so little, like the pay is nearly nothing. It's near to nothing. Like the amount of salary you're being paid will only cover the mere bills. And then you're doing a lot of work, like you're doing everything. Because most of the people let me give an example of US. Like we have people who are concerned with like the tiniest thing, like nursing assistants and those who are in charge of sluice. Like there are people who are able to help you, but then here in Kenya you are doing everything. Like you as the nurse, you'll do all the things that the nurse is supposed to do, medication, blah blah blah, but then you're the one who will come and like change beddings, medication, some lab works. Like you do most of the stuff because they don't want to hire more people and pay more people, so they hire you to pay you less and save other money for themselves. And that is why nurses keep on, like we have nurses strike each and every other year, and it's because of the low pay and too much work. So people move to other countries to look for better options. But then the reason as to why people are not looking for other alternative career options in their own country is usually because most of us don't know of any other alternative options as medics. Like we only know you as a nurse, you're supposed to work in the hospital. Like we don't know anything like nursepreneur or any other options that we have never even heard about it, not in school, not even in our places of work. We only know that you as a nurse, you're just supposed to work in the hospital. So because of that lack of knowledge, most of us usually have to like move to other countries or stay in your own country and suffer. One thing I actually wish for is that those who move to other countries like the US, UK, Canada, like there's so many things you learn, there's so many things you see. Like why is it that people don't come back and start those things in their country? Like I really want to know why people don't like move and come and start something that you've seen there, and like someone hasn't started it in your own country, you come and become the first person to start it. Like I don't know. Anyways, the first career option is lifestyle medicine. With the increase in lifestyle diseases, and most people usually like require knowledge about their diseases and ways to prevent themselves from getting these diseases, you can start lifestyle medicine. And most especially with the increase in mental health cases, like nowadays in, I don't want to say this generation, but like during this era, like mental health problems have really increased. So you can just do a lifestyle medicine whereby you can specify in something. Let's say you've specified in diet, or you've specified in exercise, or sleep, or mental health. Then you take that niche, let's say yours is mental health, and you like start talking about it in whichever way that is comfortable with you. You can start writing. You can be like creating YouTube videos. You can do online coaching. You can do telehealth whereby you talk to these patients one-on-one. Like there's so many options that you can just research about, and then you can start coaching on different aspects of life, diet, whichever that is comfortable with you. Number 2, you can become a medical writer. So whichever career you are in, you're a doctor, nurse, you're a pharmacist, you're a lab tech, whichever career you are a nutritionist, especially nutritionists nowadays. Like I usually want this information, like especially if you have a baby, you just want to like look for which is the type of food I can give for my 6-month-old. Like there are people looking for so much information, especially nowadays in this area, by people are depending on the internet. Like everything, people are looking for everything in the internet. You can take advantage of that. If you're a medical writer, if you like writing, I tried writing, but I realized writing is not my thing, because I only got to write one post about hypertension, and that was the first and the last one I did. So I realized it's not my thing. So if writing is something you're interested in, you can write posts about different diseases, about let's say if you're in maternity, people are just sitting at home and they have like different problems. It's not that people don't want to go to the hospital, but people at times we're just concerned. You're like, let me check if I can find this on Google. So you can take advantage of that and be a medical writer. Also, you can be a tutor, like you can teach people about different things. Let's say you've specified in maternity. You can teach women about different, let's say during the first trimester, what they're supposed to expect, what the challenges they can face, how to deal with certain things, diet. During the third trimester, the kind of exercises they can do, how to like be ready for labor. There's so many things. Like when it comes to the medical field, there's so many things that you can teach people about. You can just niche down and choose one specific thing you want to teach people about, and then you can like use the platform that you're comfortable with. You can write, you can like create videos on YouTube, and like people are ready. Like people will listen to these things, because nowadays like the world has become so broad, and the technology has really been working for most people. So you can just get into technology and create your own things. You can even become a career coach. I think I also tried becoming a career coach. Like you've already gone through medical school, you've gone through nursing school, and there's a lot of knowledge you have about the career you are in. So you can teach fellow nursing students, or if you're already a nurse, you can teach nursing students what they're supposed to expect during their time in college, and like how is it after college. Like there's so many things you can talk to them about. You can become a career coach. So you can become a career coach, a tutor, a writer, depending on whichever subject you are most comfortable with. You can just choose and go with it. And then number 3, you can become an occupational nurse. So you are the nurse in a given business or a given organization. Let's say in a school, you're the school nurse, or in a certain business, you're the nurse, especially the organizations whereby they work in really, I don't want to say dangerous, but places where they work, they usually get frequent injuries, and they usually want a nurse to take care of them. You can work there as the nurse, and when the emergencies become so severe, you can like refer. And actually, like, I'm so interested in such kind of nursing, because our person doesn't like the whole hospital thing. So you can get into occupational nursing. Number 5 is telemedicine. As I said before, like technology is really becoming so helpful. Although it has its own downfalls, but it's really becoming so helpful. So let me give you an example of those who have chronic illnesses. Like when you usually work in this public hospital, you usually see like it's so congested, because people are coming there only to ask questions, like to ask something because they have a certain concern. And these are things that we could have been doing just from home. Don't get me wrong that I'm saying that people should be sitting at home. Yes, you're supposed to go out, have fresh air, what and what. But remember, also, like, you can get these other kind of diseases when you keep on going to the hospital each and every time. You get me? So through telemedicine, we can be communicating with our patients. Let's say the doctor is in charge of the diabetes patient. We'll have contact of all these patients, and maybe whenever they have any question, like at times you've even forgotten like what the doctor prescribed, you can just call the doctor and they explain it to you, and you don't have to move to the hospital. But then, before you get into most of these practices, please make sure you have a license so that you don't get yourself into problems. And then lastly, we have sports medicine. And this is most especially if you're interested in the musculoskeletal exercises. So, like, you can work for a football team. Like you're the nurse in charge of that team, or you're the doctor in charge of that team. You can work for a certain university. You can work for a certain like private company whereby they need someone to like check on, let's say, their players, or to check on the people who work in that place, and they usually use a lot of energy. Like you can get into sports medicine. Now, with all that I've said, The big problem is most of these things are actually so hard to start in most African countries because Africans with ignorance, they usually know they don't require all this. Like they know they don't require someone to talk to them on the phone, so they won't, like if you start this company, most of them will just ignore and say like what is he or she starting. They don't feel like they require someone to coach them on the musculoskeletal exercise, someone to come and check on them every time before they go for a certain game to see if everyone is fit to go for that game. Like most of them actually think that most of these things are not important. Like we have doctors in the hospital, they can just take care of us, yeah. And then most Africans too, they don't want to struggle. Like so many Africans read books. So many Africans don't read books. So that means they won't be writing. That means few people will be interested in writing. Most Africans, like they feel it's so hard to just sit down and research and create videos. Like most Africans don't want to struggle, and that is why like most career options are so hard to start here. But then I think it's high time. It's high time we like started looking for other career options so that we can reduce the number of unemployment, especially in our country, Kenya. Like to reduce unemployment, people need to find other options. Like we cannot all be in the same career. Like yes, we've all gone to nursing school, but we can all not be nurses in the hospital. We can get into doctorpreneur and nursepreneur. You can start your own kind of business. Like I think I'm crazy about this because at the same time I wanted to start a business of selling scrubs, but then my problem was I wanted to like get them from India, but then it was so hard because I was scared of being scammed. I had like the company that was supposed to like deliver them for me, I had a research and I realized that they usually scam people. So because of that scamming and what, like I said, I'm not going to do that scrub business anymore. So that is just an example. Like you can find something that your fellow nurses usually need, and you can start selling. You can sell ebooks. Like if you're a student and maybe you have notes, you can sell. Let's say you want to write about the musculoskeletal system, you can just write down notes and sell like in ebooks and all Amazon, all those other places that people usually sell books. But it requires you to push yourself, and that is what most of us Africans don't want to do. We don't want to push ourselves, but it's supposed to try. Let's try this 2024. Let's try and look for the options. Me, I usually say unemployment is not the end of things. Like personally, I've never been employed. Like I've just been doing locums. Finding a job nowadays is so hard. But I told myself, I'm not going to sit down and wait for someone to employ me. I'm going to research, look for other options to make money apart from working in the hospital. Yeah? So, anyways, thank you for watching this video. And if you're interested in buying the items I sell, I usually sell crochet items. Like I made this barrette, I made this cardigan. So I usually sell crochet items, and if you're interested, you can DM me on this number or at Howie Crochets, and I'll be able to make anything for you. And thank you for watching this video. Make sure you subscribe, you like, and you can comment down which other video you'd like me to talk about. And yeah, thank you for watching this one, and I'll see you on the next one. Bye bye.